How to cure prostate cancer with natural medicines. As my dear friends of YouTuber are in this opportunity, we will talk about how to cure prostate cancer. Prostate cancer is a disease in which malignant cancer cells form in the tissues of the prostate. The prostate is a gland of the male reproductive system that lies just below the bladder. It is the organ that collects and discards the urine and in front of the rectum, the lower part of the intestine. Its size is like that of a walnut and surrounds a part of the urethra. It is the tube that carries urine to the outside from the bladder. The prostate gland makes a fluid that is part of the semen. Prostate cancer is more common in older men. In the United States, approximately 1 in 5 men will receive a diagnosis of prostate cancer. Although the exact cause of prostate cancer is not known, certain risk factors have been linked to prostate cancer. A risk factor is something that increases the chances of the person contracting a disease. Age is the main risk factor for prostate cancer. Family history also plays an important role. If the father or brother of a man has prostate cancer, your risk is 2 to 3 times higher than the ordinary average. Diet is also an important factor. Men who eat a lot of animal fat, especially red meat fats, you may be at higher risk of getting prostate cancer than men who eat less animal fat. Prostate cancer, as well as other conditions, can cause these signs and symptoms. Check with your doctor if you have any of the following problems: weak or intermittent urine flow, stops and exits, sudden urge to urinate, increased frequency of urination, especially at night, difficulty to start the flow of urine, difficulty emptying the bladder completely, pain or burning when urinating, presence of blood in urine or semen, pain in the back, hips, or pelvis that does not go away, shortness of breath, feeling very tired, rapid heartbeat, dizziness or pale skin due to anemia. Other conditions produce the same symptoms. As men age, the prostate becomes enlarged and obstructs the urethra or bladder. This may cause urinary or sexual problems. This condition is called benign prostatic hyperplasia (HPB), and, although it is not cancerous, sometimes you need surgery. The symptoms of benign prostatic hyperplasia or other prostate problems resemble those of cancer. A normal prostate does not obstruct the flow of urine from the bladder. Enlargement of the prostate puts pressure on the bladder and urethra, and obstructs the flow of urine. To detect, find, and diagnose prostate cancer, tests that examine the prostate and blood are used. Screening tests verify the presence of cancer before the person has symptoms. This may help find cancer at an early stage. If abnormal tissue or cancer is discovered early, it is easier to treat them. When the symptoms appear, perhaps the cancer has begun to spread. The following tests and procedures can be used to detect prostate cancer: physical exam and history, body exam to check the general state of health and identify any signs of illness, as masses or anything else that does not seem normal. Data are also collected on the patient's health habits, as well as the history of diseases and the treatments applied in each case. Digital examination of rectum (DR) examination of the rectum. The doctor or nurse inserts a finger into a lubricated glove in the rectum and feels the prostate through the wall of the rectum for lumps or abnormal areas. The prostate-specific antigen (PSA) blood test is used primarily to detect prostate cancer in men who do not have symptoms. Prevention and early detection of prostate cancer. It is also one of the first tests performed on men who have symptoms that could be caused by prostate cancer. Most men without prostate cancer have PSA levels less than 4 nanograms per milliliter of blood. The probability of having prostate cancer increases as the level of PSA rises. Next, we will give you the natural foods and herbs that will help you fight this disease. But this does not mean that you should leave your medical treatment that is vital in this delicate disease. Soya. The American One Cancer Society revealed that soy is associated with a lower risk of developing prostate cancer. This is an important source of vitamins, proteins, minerals, plant fibers, lipids, and isoflavones. 2. Beans. American Cancer Society says that beans reduce the risk of suffering from this disease. They are high in fiber and vegetable protein, so they are a healthy alternative to protect the body against prostate cancer. 3. Broccoli, sulforaphane, chemoprotective against cancer, and isothiocyanate abundant in broccoli could impede the process of cell proliferation in the early stages of prostate cancer, says Francisco Macias, professor of organic chemistry at the University of Cádiz, in Spain. 4. Tomato, it is rich in lycopene and takes TUB, substances with a high antioxidant capacity that prevent cell degeneration leads to cancer, especially prostate cancer, says Alberto Fernandez Gutierrez, director of the Center for Research and Development of Functional Food Technology, Health Sciences of Granada. 5. Aloe vera, pure aloe vera juice attacks the initial phase of cancers like lung, pancreas and probably the prostate, although it is also believed that it helps in chemotherapy treatments to cure mouth sores, stomach, and intestine. Because of its rich germanium content, it protects the immune system. Well, my dear friends, I hope this information is very useful to you. If you like it, do not forget to give it a like, and, above all, do not forget to share this video with those who need it, and, above all, subscribe to my channel. Have a nice week full of prosperity and achievements. Many blessings.